So if you're reading this on the blog post, I told a story in the blog about a friend of mine who I dealt with years ago who had had a stroke. Now with him, he had gone the entire weekend and had a stroke, and none of his family or friends picked up on it. So part of what we'll talk about today is how to recognize those things so that if one of your patients or even a family member was to have a stroke, you're confident in recognizing those signs, but also how to deal with it so that you can get them the best help possible. So if you remember when you took your first aid course last time, every single scene that you ever dealt with, you went through a primary survey and then a secondary survey. So in this instance, the secondary survey is the most important part, because if you remember, the primary survey is all about making sure the scene is safe and then making sure that the person has their ABCs, which is airway, breathing, and circulation. So if somebody comes into your clinic and they're sitting on your table, you automatically know already that they have their ABCs because they're walking around and they're talking to you. So going through the secondary survey is the biggest thing that's going to tell you those signs and symptoms of the stroke. So I've got somebody that's going to help me out with it. And if you remember, one of the big things that first aid recognizes for a stroke is the mnemonic FAST. So FAST stands for face, arm, speech, and time. So somebody who has a stroke, usually one side of their body is the side that's affected. So you'll see a little bit of drooping in the face. The motor skills, like through the arm and leg, won't work properly on one side. Their speech is going to be slurred. And now when it comes to time, they're not going to have a real great concept of time, but also time means that it's of the essence in order to get them to the hospital and get them help. So now we'll just run through how to recognize that and how to deal with it should you ever have somebody come into your clinic who's had a stroke.